with Professor Bulie Magula with regards to the medical fraternity, how it's dealing here in South Africa, what sort of support South Africa has been dealing with. We've also been having a look at the various vaccines, the various trials that have come into play. At this point in time, there has been no specific treatment or vaccine that has been confirmed to work. So earlier on, Professor, just before we crossed over to that National Command Post meeting, we were going through some of the treatment options that had been available. I'd like to now move away to have a look at the support that the South African medical fraternity is receiving both from the public sector as well as from the private sector. In China, we saw students now, as things are starting to go back to normal in China, they're in the laboratories, they're trying to help medical facilities, trying to find various vaccines. We've also seen other scientists from Israel also coming to par. Earlier on, reports also from Cuba, doctors are going to be sent into Italy to go and try and help the situation. Are we seeing the same sort of support here in South Africa?
At the current time, we have hospitals in South Africa putting into place their disaster management plans, where elective procedures, for instance, are delayed and only which are critically ill or that have to be in hospital, so that staff are being prepared, doctors are being trained, nurses, all caterers in hospitals are being prepared to respond to the pandemic that we're facing. We do need to express a call to all other clinicians that may not be actually sick, that is their problem, that everybody needs to actually come to the party, that we work together as an integrated workforce. So that is actually something that we as clinicians or the medical fraternity can. In terms of research, there is conversation that is underway with the World Health Organization to engage the country on a global effort to respond with a randomized controlled clinical trial earlier on, and hopefully, clinicians have to apply their minds on the, risk benefits and so on of participating in trials. So those conversations are underway. We actually still have regulations, all the regulations in the country will engage in clinical trials. So it's not like we can just quickly jump into
Professor,
engaging.
unfortunately, I'm going to have to interrupt you there. Unfortunately, network is not on our side this morning. We're going to try either call you back via Skype or via phone line to be able to establish a better network with you. Of course, in conversation with Professor Bulie Magula, just taking us through some of the COVID-19 measures specifically coming in from the medical fraternity, the impact that that's had. And of course, she is Professor Bulie Magula, the head of Department of Medicine at the University of KwaZulu-Natal Medical School. Well, President Cyril Ramaphosa is currently meeting with the National Command Council on the implementation of those directives that were announced last week Sunday.